The rate of suicide among doctors is twice that of the general population, and one of the highest among any profession. Stress, burnout, and trauma all contribute to this devastating toll. Through collective conversation and dedicated action, we can begin to return the favor to the physicians who care for us by helping them better access the resources that they often need. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle, senior writer for the AHA. Thoughts of taking your own life aren't easy for anyone to discuss, let alone doctors. Dr. Michael Weinstein, associate professor and trauma surgeon at Thomas Jefferson University Hospital in Philadelphia, bravely shares his personal struggle to practice medicine and serve his patients while battling depression and thoughts of suicide. In this Advancing Health podcast, AHA Senior Vice President and Chief Medical Officer Dr. Jay Bott and Dr. Jerry Reed, Senior Vice President for Practice Leadership at the Education Development Center, sit down with Dr. Weinstein to discuss his journey of hope and recovery as a physician who struggles with mental illness.
Welcome, Dr. Weinstein, and thanks for joining us. We're so grateful for your work and for the candid conversation you're having with the field and with us today. To get us started, Dr. Weinstein, please tell me a little bit about yourself and your interest in the topic of physician suicide.
Yes, well, thank you very much for having me, and thank you for doing this important work. I've been a trauma surgeon, acute care surgeon for about 20 years. And in addition to that, I've had lifelong issues with dysthymia and depression. And I found myself just a couple years ago in the worst episode of depression in my life, and became profoundly suicidal. And it was only thanks to a lot of different folks, mostly my wife and family, who kept me safe, that I didn't in my own life. And I made a fascinating recovery. Not that it's always wonderful and glorious, but through my recovery, I've really developed a passion for life and a new understanding about what it is to be alive, and just so thankful that I didn't take that last step. And going through that process and then healing was extraordinarily empowering. And I really wanted to address this topic because I see too many folks suffering, and certainly too many folks in medicine taking their own lives. And the stigma that's associated with mental illness or mental suffering in medicine and in our larger community is really dangerous. It keeps people from seeking help. It keeps people from getting the attention that they need. And depression in and of itself, especially when you become suicidal thoughts, can be very isolating. Without the awareness that other people are suffering, and the more we can talk about it and then have these conversations out in the open, I think the more we can help people. Because I know in my heart that no matter where you are in life, what you're going through, that there's always a path forward. I believe that for every individual, and just want to spread that word.
Well, thank you, Dr. Weinstein. We are so grateful for your leadership, your courage, and I know that many patients, families, and communities are glad you're here with us doing the important work that you're doing and caring for people, but also talking about these important issues. And so I know that other clinicians, and myself included, resonate with this place of being in a place of depression, and we don't typically ask for help, but asking for help is being important. And so I also want to invite Dr. Reed from the Education Development Center, who's a wonderful collaborator with us in this effort around bringing insights on physician suicide and trying to create awareness and address the issue in partnership with the field, to offer a few comments before we jump into the questions.
Thank you, Dr. Bett, and I appreciate your comments, Dr. Weinstein, thus far. In my role at the Education Development Center, I oversee a number of suicide prevention initiatives, such as operating the National Suicide Prevention Resource Center, which is a federally funded resource center that addresses the 47,000 lives that we lose last year. The last year we had data, in addition to the 10 million Americans who suffer with thoughts of suicide within the last 12 months. So it's the 10th leading cause of death, as many of us know. And in the physician community, we know that we lose between 300 and 400 physicians every year, which is a very significant number. It's really important, I think, for our conversation to take the time to, as Dr. Weinstein suggests, to make sure that we have this conversation openly, encourage those who are struggling with thoughts of suicide to get the help that's now available for suicide, and to make certain that we don't overlook the opportunity to provide care to the caregivers, because your service to others is life-saving for them, and we need to be equally as committed to providing service to our medical community when they struggle, so that they can continue to do the incredible work that they do. So I'm very grateful. We have a national goal in the United States to reduce suicide by 20% by 2025. And now we've gotten to the point where we have enough information that we know where the burden of suicide exists in certain populations and working groups. We know our veterans struggle. We know those in the middle years of life struggle. And if we become more targeted in our prevention and treatment efforts to the environment and the populations of those we're trying to reach, I believe we will have success. And so that's the reason for this call today. And I'm just incredibly grateful to the American Hospital Association and you, Dr. Weinstein, for the time you're taking to help us lift the veil of secrecy that has for far too long surrounded this topic. So, Dr. Bett, back to you.
Great. Thanks so much, Dr. Reed, and I really appreciate the important work that you and your team is doing on this issue. So, Dr. Weinstein, can you describe what it was like to experience depression and practice medicine at the same time before your treatment, and what is it now like after treatment?
Yeah, thank you. I think it's worth noting, as I was listening to you, Dr. Reed, in terms of the residents, the house staff, the physicians in training. Actually, the number one cause of death in male physician trainees is suicide, and it's number two in females. And then, 20 to 30% of physicians and many other healthcare providers suffer from depression. There are many of us out there who suffer from depression and do practice medicine. And in some ways, I think some of the depression stems from these notions of perfectionism and striving for perfection and never being satisfied with what's going on in the present. And I think many of us who do suffer from depression are quite committed and quite empathic and tend to take excellent care of our patients, even up to one of the last things that we're able to do is at least engage in patient care. We seem to hold on to that dearly, but it is challenging. I've suffered from issues of depression and very negative and critical self-image for quite some time, and it's easy to lose confidence at times with that type of mindset in terms of second-guessing oneself, communicating with others, and in terms of attending to suffering when one is in and of themselves suffering. One can both be compassionate with another person that's suffering, but it's also hard to witness and let that go when you leave that conversation or that presence. After this recovery, I've kind of discovered a new way of appreciating the present moment. I'm appreciating life, appreciating all the good things that we do in medicine. We tend to have, at least many of us with depression or burnout, tend to have negative thoughts about the practice of medicine and negativity bias, so that we see all of the problems. So looking around and seeing all of the great work that's being done and focusing on the good parts and where we can improve things it was kind of a new way of being. And then going through that and actually being in recovery, I even have a heightened sense and can recognize symptoms in others, both colleagues and trainees, and as well as, of course, patients. And I feel as though I'm actually able to connect in deeper ways. I still certainly have changes in mood, and so that not everything, again, is always hunky-dory, but I've developed tools to work with that, with negative aspects and as well as negative self-talk, to recognize it for what it is and to move past it, so that I've noticed that those periods of negative affect have been shorter and more transient than some of the periods that I've had in the past.
Thank you, Dr. Weinstein, and I really appreciate that thoughtful response. I think there are important, elements of sort of awareness and recognition, and I think you shared some of those, so appreciate that perspective. Dr. Reed.
Dr. Weinstein, I was really moved by your comment that you are there to serve the suffering, yet that's compromised at times by your own suffering. I've been doing this work for many, many years and have never heard it put quite that way. So thank you for that insight that, really helps us understand that when you're in the business of caring for those who struggle and yet you struggle yourself, how much harder that effort can be. And you spoke eloquently, I think, to the value of, recovery. And while it's not a perfect journey, once you're diagnosed and treated, you're far more understanding of those you treat. And I can tell you, as a patient for many, many years, I can tell when my practitioner understands my pain, whatever that pain might be. So I just want to thank you first and foremost for that observation. I'd like to ask you, if I may, can you speak to any stigma or shame you experienced after seeking help or sharing your story from perhaps patients, peers, or administration in the clinical settings where you've practiced?
In many ways, I guess you could say I got out in front of the stigma in order to decrease stigma generally. And I think there's kind of internal stigma and shame, and then there's external stigma. I find that perhaps the internal stigma is even worse. That's the idea that I know myself that I am weak because I have depression, because I'm not able to cope with this and I need to go out from work, for instance. The external stigma, I think, tends to be more subtle, although at times it can be overt. But, after I published this article and put myself out there in a quite a big way, there was really no stigma and shame. And, my inbox was flooded with beautiful emails, phone calls, people calling my office. I was really inundated with a lot of really understanding folks out there who, some simply said thank you, and some shared their own story. Some even said that, this message, this reading this story came at a very critical moment for them, and perhaps at least change their trajectory for that time. So I really haven't experienced any stigma or shame since publishing the story, and I think in some regards the stigma that I felt was a lot of it was generated by my own mind and my own interpretation of the environment. Those messages are at times again subtle, but the message is that the folks that we kind of put on a pedestal are the ones that come in real early in the morning, stay to all evening, work hard, are dedicated, tremendous self-sacrifice. And, especially in the world of surgery, extraordinarily confident and resilient and able to handle, especially as a trauma surgeon, handle any kind of situation that comes through the door. Those messages in some ways lead to one thinking that any type of inability to meet those quite high standards is a failure or is a weakness, and so that gets compounded within the brain, at least in my experience.
Thank you. That makes an awful lot of sense, and I'm delighted to hear that you were so well received by your colleagues, your patients, and those with whom you worked. And boy, I hope that's a message that we all take away from this conversation, that it's okay to seek help and it's a sign of strength to do so. So I'll turn it to Dr. Batt for another question.
And I'll echo Dr. Reed's comments about how encouraging it is to see that kind of response and the strength that you demonstrated. So, that strength came from a particular place. And what was it that finally led you to seek help? And what was the message there? And how did that end up resonating, and what was the result?
Yeah, so I guess it's kind of complicated, but I've suffered for quite some time, and so I've been in and out of treatment in some way or another since I was in college, and at times would fall out of that treatment, and one for lack of time. Also, I told no one up until the end when I went out from work. I was embarrassed that I was seeing a psychiatrist or a psychologist, and I would have to figure out how to get some time to get out and see folks, see providers. And in many ways, I think that internal stigma, that lack of sharing with colleagues, led to a lot of resistance about some of the treatment. And I wasn't always adhering with medications, and I wasn't always adhering in a longer term with therapy. And I found myself in the fall of 2015 in absolute despair. And certainly my wife is someone I've always been able to. She obviously. She knows me quite well and knows when I'm suffering. And while I haven't always been able to speak my mind or talk about what's going on, she's always been able to attend to me. So I had that collaboration, which was critical. And I remember that fall calling many times when I was on call, calling my wife in absolute tears, saying, I just don't know what to do. Certainly some suicidal ideation, but fear of dying, and taking some extra risks to, hopefully get hit by a car, or at least severely injured or killed, not necessarily in an active way. But she said I was getting worse and worse. I was seeing a couple psychiatrists. We had a lot of different medication changes, and nothing was working. It was definitely treatment-resistant depression. And she said, "Well, let's go see your family doctor, who's a colleague of hers and a colleague of mine." And he gave me permission. Essentially, he said, "I'm taking this out of your hands. You have to stop working now and get help." I think that's what I wanted. I realized that I was suffering tremendously in no small part. A lot of my suffering was at work, and I couldn't conceive of leaving work though and sharing what was going on with anybody outside of my family. So that he simply said, "No, this is it. You're going out of work. I'll call your boss, your division director." So it was it was as though I had finally had permission, that someone said this is the right thing to do, and it's okay. At the same time, when I went out of work and I went to a hospital, I thought of all the worst things that people at work would think about me. I thought that I was quite confident that I would never be allowed to return to work again, which was not in effect the case. So in terms of what message, I needed someone to tell me what to do at that point, and give me some strong advice to get a higher level of care and more help.
Thank you. That makes really powerful testimony. And, I think it just accentuates the value of protection. And, while we have risk and protective factors in a lot of health areas, and we want to minimize risk and maximize protection, it sounds like, you had a very engaged wife and a very capable and competent family doctor who knew exactly how to respond to your needs at that time. And give you the space and the permission, if you will, to take care of yourself fully and completely before you came back to the work environment, so you could be both comfortable with yourself but also comfortable with your practice. Is that right?
Yeah, and I must say how fortunate I am to have my wife, to have had that interaction with my family doctor, and to have there's a lot of people in my life that really were quite supportive, and I know that's not always the case. And so I try and tell people, early on, try and find someone in your life that you can confide in, and someone that you can kind of create a plan so that when if things do get worse, it's someone that you can reach out to for help, and set that in place. So I think we need other folks to help us.
Excellent. Dr. Weinstein, now that you're in recovery and doing well, what are your personal strategies for staying well, maintaining your well-being? And have you seen these change over time from the period you were struggling to the now period where you're in recovery? Has your personal strategies for staying well changed at all?
Yes, completely. For years and years, I wasn't really taking care of myself. I was pushing away the negative feelings and thoughts, and in many ways I guess I shouldn't say I was pushing the thoughts away, because in many ways, I believed all of those thoughts to be 100% true, that I'm a failure, that everything in my life is failing, and that this world, including the people I absolutely love, would be better off without me. As I recovered, it was one small shift occurred when I was actually reading a book about acceptance and commitment therapy, and the notion of that thoughts aren't necessarily real, are not truthful, are not reliable, and that you don't have to buy into them and listen to the thoughts that we have in our heads. It's like a revolutionary idea for me, that I don't remember ever understanding that or believing that. And it took me a while to actually, I would say, truly believe and live that. And so I started to discover mindfulness and meditation, and be able to actually create, even just creating a small distance between myself and the thoughts that my brain generate has been life changing. I had approached mindfulness over the years. I tried to read a little bit of John Kabat-Zinn over the years, and nothing ever resonated with me previously. I think that has to do sometimes with the way in which we're trained as physicians and certain mindsets. But, finally going through this really challenging struggle that I thought was never going to end, and opened my heart to really understand and embrace, the idea of paying attention and noticing thoughts, but not acting on them or believing the thoughts, and paying closer attention to what my mood is like and what it feels like in my body, and how noticing the patterns now of when my mood dips, how the negative thoughts come back and can be really difficult to work with. And So I think one of the biggest things is simply paying attention in a different way than I've ever paid attention. And then, various exercises, these days, I hate to even say it because I hear so many physicians say, don't tell me about mindfulness and yoga, but I do mindfulness and yoga, and it really helps support my well-being. And, I think it's given me a larger perspective, in many ways. I'm looking at my career and thinking, well, what's next? I don't, the world of surgery may not be for me at this point. And, what other things can I do? And let me be intentional about what I'd like to do in my life, rather than reactionary and taking, kind of just falling into various situations, never saying no, and finding myself doing things that I wasn't necessarily appreciating.
I was just going to say thank you to Dr. Weinstein. I love the comment about intentionality. I think it's a powerful concept to think about. So I'll turn it back to Dr. Batt.
I would agree, Dr. Reed. I think this intentionality is really important. And this, I think, notion of that there's system challenges and personal challenges, and that they're not exclusive of each other. And so in certain instances, you may need mindfulness and yoga and other kinds of supports that fill the tank and bring joy and build capacity for resilience. But then there are also system issues that we've got to think about and address in order to reduce the risk of physician suicide, so that our caregivers are functioning in a system that supports caregivers being able to do the things that they were trained to do. So I think that's really relevant to the comments that you've shared today. So I want to pivot to this piece about how do we offer some suggestions to the field about self-care. So how do we teach self-care? What might this look like with clinicians in medical practice, those that are in training, which may have a different context? And when you talk about deploying tools for reflection and self-care, what do we mean?
Yeah, thank you for that. Certainly, as you point out, there are a lot of environmental difficulties in the field of medicine, and they need to be attended to. At the same time, I think as individuals, I would suggest we have a moral obligation to take care of ourselves, because taking care of ourselves enables us to best take care of others. And I think that the positive change that will come in the environmental factors will come from people who are taking care of themselves, who do have a greater sense of awareness and perhaps can see things for truly what they are and see positive solutions, rather than many of us we do is simply complain about all the problems, but don't necessarily come up with solutions. So in terms of the self-care component looks like, I think it's complicated because it's different for all individuals. But, we talked about attending to suffering. We, as physicians, pretty much no matter what field you enter, are attending to other folks suffering, right? That's what we do. And I think in order to do that well, you need to be able to check in with yourself and notice what comes up in you, and notice how you then incorporate that into your being, and how, when you move on, what's left of that, what's still there. Developing that self-awareness, the best way I know of that is mindfulness meditation. And I think both teaching and role modeling that sense of attention and awareness early on in training, very early on, is critical. Because if you're not paying attention in that certain way and having time for reflection, it's easy to get lost in this world, and it's easy to get dragged down by a lot of the negativity that is present. On top of that, I talked about role modeling. I think our leaders and our teachers need to embrace the idea that self-care is critical for us, again, to take care of others and to work in teams, both, again, role modeling, taking time to take care of oneself and being demonstrative about what you're doing, and building in value and time for folks to take care of themselves. To me, that's the biggest area. So, being able to take some time and understand what it is you're going through, understand one's own suffering, what it's like, what it feels like, is because we all do suffer in small and large ways over the course of our lives. And the more we can be ready for that, for these events and these turns that come in our lives and facing the difficulties of medicine, I think we need to be much better prepared. And I certainly wish that I better understood ways of working with the mind a long time ago. It took me 50 years to figure this out. Not that I've figured it out, but certainly to make a change in my life in a very positive way. I really am a big advocate for getting these types of tools of self-awareness and self-compassion into our earliest forms of education from medical school, and perhaps even folks need to develop some sort of a self-care practice before entering or as they enter medical school, because certainly the data would suggest that even within a year or two of medical school, people are already beginning to suffer more. So early on, and placing a huge emphasis on that need of self-care and as an obligation, as being a professional. Part of professionalism and is taking care of oneself.
Thank you, Dr. Weinstein, for your story and your insights and your courage and sharing approaches that other physicians and caregivers might consider in this context related to physician suicide. I have no doubt you are helping countless others by sharing your story, your journey, and your recovery. So thank you. Dr. Reed, do you have other comments you'd like to add to close us in this conversation today?
Thank you, Dr. Bott. I'd simply like to thank Dr. Weinstein for his courage of stepping forward and sharing his own lived experience with suicidal thoughts. And, I've long believed and hold firmly that if we have to talk about suicide to inspire action, if once we have action, we lead hopefully to people seeking help for their challenge. And once we seek help for our challenge, we are able to help many return with recovery as the operating principle and doing the great work that Dr. Weinstein is doing with his patients and things of that sort. So I really appreciate the candor and the courage to speak about the issue. I agree with Dr. Batt. You've helped more people than you probably will ever know through your testimony today. And I truly believe that we are making a difference. And when people who struggle know they don't have to struggle in silence, but can step up and hopefully receive the kind of reception and journey that you've been able to share with us today, we're going to reduce the numbers of those we lose to suicide in this country. And I'm very grateful for your service to medicine and your service to this cause today by talking to us.
I often say when speaking about this, people ask, how was it to publish your story? The courage in some ways wasn't to put my story out there. The courage is living through that depression and practicing medicine. It takes tremendous strength to do that. People don't realize the strength that they have, that they're using to get through this suffering. I know that you have tremendous strength and can work through whatever it is you're going through.
Yes, here. And I think I echo Dr. Reed's comments, your comments, Dr. Weinstein, for how we might think about this. And I also take away that challenge is an opportunity for positive transformation. And you've certainly demonstrated that. I want to thank all of our listeners who've tuned in to this podcast and hope you continue to share this story with others in your community. And we look forward to the next set of conversations that are forthcoming. And we hope that these resources can inspire action so that we get reducing suicides among physicians around the country. Thanks so much for all that everyone is doing on this issue, and we look forward to checking in with you next time.
It's said that doctors make the worst patients. Maybe, but physicians have the same needs as anyone else, and when it comes to dangerous depression, Dr. Weinstein has sent a critically important message to his colleagues. There is a way forward. This has been Advancing Health, a podcast from the American Hospital Association. Thanks for listening.